let's say a few words about platelets. On the platelet surface, as we're talking about autonomic nervous system, we should mention alpha-2 adrenergic receptors and the stimulation of alpha-2 adrenergic receptors by epinephrine, by norepinephrine that's present in the blood, in the plasma, blood plasma, causes platelet aggregation. Stimulation by epinephrine, norepinephrine are responsible for platelet aggregation. But also, just to let you know, platelets have another type of receptors, like receptors to thromboxane A2. They have receptors to ADP, adenosine diphosphate. They have receptors to serotonin, 5-hydroxytryptamine receptors. They have receptors for platelet-derived aggregation factor, and also they have GP1B receptors for von Willebrand factors, and they have GP2B3A receptors for fibrinogen. So many of them. But as we're talking about autonomic nervous system, we should mention here alpha-2 adrenergic receptors, right?